Hello y'all, welcome to the Nursing That Makes Sense channel here in YouTube. So welcome back. If you saw my first introduction video about this channel, you know that I'm recording this in Texas, and in Texas is currently very hot. We have over 90 degrees outside, so I'm encouraging everybody who's watching this in the areas where it's too hot, like the southern part of United States and the western part of United States. Encourage everybody to hydrate, take care of yourself, stay cool, and stay safe. Okay, so I'm gonna jump start this Nursing That Makes Sense channel by answering a question that I commonly encounter when I start talking about evidence-based practice, which is EBP, and that would be the formulation of the clinical inquiry using the PICO format. So the PICO format is actually like an algorithm in which, for any individual who's interested in developing evidence-based practice, one has to create a question so that question will guide the search for evidence. And so PICO is actually an acronym, and it has four major components. However, you will encounter that every now and then a lot of us clinicians and those who are doing evidence-based practice tends to add those two letters towards the end, which are the two T's. So the P stands for the patient. Now, this is what the population of interest that you're going to be discussing about or trying to figure out. So this can be surgical patients, medical surgical patients, or diabetic patients, or those patients that have history of hypertension, or any surgical patients. So the P is really associated with the participants or the person of interest. Letter I stands for intervention, and this is the intervention or the strategies that you're trying to determine whether it's effective or not. So for example, you want to determine whether the use of wristband, so pressure wristband that you put in the patient on the patient's wrist, and you want to determine whether it's effective at mitigating or reducing the incidence of post-operative nausea and vomiting. So that would be your intervention. And then the comparison is usually those current practice that we have, and that's the reason why we do evidence-based project. It's because we want to determine whether there is a new, much better interventions than the common practice that we have. And then of course the outcome means the things that you're expecting that the intervention will produce. So like for example, as I mentioned earlier, if you want to determine whether the pressure wristband is gonna reduce the incidence of nausea and vomiting post-operatively, the nausea and vomiting post-operatively would be your outcome. Okay, and then like I said, every now and then you're gonna see some of us or some of these clinicians that are doing EBP will add these two letters at the end of the PICO, and those are lettered two T's. And the first T is the type of questioning. There are various type of questioning that you would see in a lot of EBP courses. One of them would be therapy, the other is etiology, and then of course diagnosis, prevention, and prognosis. Now that is beyond the scope of this video here, so I'm not going to explain those different types of questioning, but bear in mind when you're doing a PICO question, you take into consideration the type of questions that you are creating. And then finally, it's the type of evidence. And what are the types of evidence? There are so many hierarchy in terms of the levels of evidence. You've seen Melnick and finite overhead operating system. You have seen the Johns Hopkins nursing evidence-based model. You have the Iowa model, and you have the Cochrane collaboration. So there are many types of leveling of evidence, but the commonality between all these levels of evidence really is that level one are systematic reviews or randomized controlled trials. So, in a nutshell, the PICO question is actually a format. So the PICO questioning format is actually a strategy for you to start developing a clinical inquiry, and hopefully you will be able to develop a question in order for you to start searching for evidence. So I hope I make that as clear as possible. If you have any questions, please ask that in the comments section below. I would be very happy to answer those questions for you. So thank you very much. Stay cool.